You are a first responder trained in basic life support. You are working in a child care center. As you care for a 4-year-old child, she suddenly collapses. 1. Your first action is to A. Establish unresponsiveness. B. Ensure scene safety. C. Feel for a pulse. D. Begin CPR. Correct answer, B. Ensure scene safety. You must first determine that the scene is safe for the victim and you. You quickly scan the room, verify that you cannot see any threats, and call for help. 2. The next step you should take is to A. Establish unresponsiveness. B. Check for a pulse and breathing. C. Begin CPR. D. Begin rescue breathing. Correct answer, A. Establish unresponsiveness. If the victim does not immediately respond to your shouting, verbal stimuli, apply a physical stimulus, sternal rub, to assess unresponsiveness. You determine that the child is not responsive. You ask your coworker to call for help and grab the AED from the kitchen area. 3. The next step you should take is to A. Begin CPR. B. Monitor the victim until the AED arrives. C. Check for a pulse and breathing. D. Begin rescue breathing. Correct answer, C. Check for a pulse and breathing. 4. The longest amount of time you should spend checking for a pulse and breathing is A. 5 seconds. B. 10 seconds. C. 15 seconds. D. 20 seconds. Correct answer, B. You should do these actions simultaneously and for no longer than 10 seconds. If you are not sure about feeling a pulse, assume there is not a pulse. You cannot feel a pulse and the child is not breathing. The coworker brings the AED into the room. 5. The next step you should take is to A. Attempt to bring the victim up to a sitting position to provide a better airway. B. Begin CPR. C. Begin rescue breathing. D. Attach the AED and follow verbal instructions. Correct answer, D. Attach the AED and follow verbal instructions. This collapse was a witnessed, sudden collapse, so the sooner you can provide defibrillation, the better the outcome is likely to be. The AED tells you to perform CPR. You and your coworker begin CPR. 6. You begin a cycle of high-quality CPR. You know that a cycle of CPR includes A. 15 compressions and 1 breath. B. 15 compressions and 2 breaths. C. 30 compressions and 1 breath. D. 30 compressions and 2 breaths. Correct answer, B. 15 compressions and 2 breaths. For 2 rescuer CPR, you should use a 15:2 ratio of compressions to breaths. 7. High-quality CPR includes all of the following except A. Compression rate of 100 to 120 per minute. B. Compression depth of 2 to 2.4 inches for an adult. C. Allowing full chest recoil between compressions. D. Pausing for a pulse and breathing check after the first 20 compressions. Correct answer, D. You should not pause CPR for this check. When you are providing CPR, you should only pause for pulse and breathing checks, AED application, or when EMS arrives. The AED advises you to stop CPR for rhythm analysis. You stop CPR, and you and the coworker stop touching the child. The AED directs you to deliver a shock. 8. At this time you should A. Begin CPR. B. Deliver the shock. C. State for your coworker to stand clear. D. Continue rescue breathing. Correct answer, C. State for everyone to stand clear. It is important that no one, including you, is touching the victim during a shock. After verifying that no one is touching the victim, you push the shock button on the AED. 9. The next action you should take is to A. Allow the AED to check the rhythm. B. Begin CPR. C. Begin rescue breathing. D. Wait for EMS. Correct answer, B. Following a shock, begin CPR immediately for 2 minutes, or until the AED advises that it is time for another rhythm check. The AED advises stopping CPR. You move back from the child and allow the AED to analyze the rhythm. The AED advises stopping CPR. The child moves her legs weakly and starts whimpering. 10. The next action you should take is to A. Push the shock button on the AED. B. Begin CPR. C. Begin rescue breathing. D. Wait for EMS. Correct answer, D. Wait for EMS. The child is beginning to rouse, so continue monitoring the child until EMS arrives. Leave the AED in place and continue to monitor the child.